Okay guys, we are continuing our lecture with type 2 diabetes mellitus, and we just got done talking about some of the drug therapy, insulin therapy that you would do. So now again, let's move on to diagnostic studies. And just like in type 1 diabetes, one thing that you want to do is an hemoglobin A1C. Now these levels in diabetic patients will typically be, again, greater or equal to 6.5%. And typically they will want to maintain a 7% A1C. That is the ideal for diabetic patients. That is an indication of good control, good diabetic control. Number 2, fasting plasma glucose. Now these, again, fasting will be greater than 126. Again, you will remind your patient that they must be NPO, no caloric intake for 8 hours minimum prior to the test. The A1C, they do not need to be NPO. The other exam that you will do would be the oral glucose tolerance test. And let's not forget our UA. The UA, you would find large amounts of glucose in the urine. Now, what are some interventions? We talked about how you're going to be giving their PO meds. In a healthcare setting, you may also need to do insulin therapy. But before you ever do insulin therapy, you're going to have to assess those sugar levels. Okay, so you're going to have to do a finger stick. And I did this in type 1 diabetes, and this is going to get, or excuse me, I'm going to do a real quick brief overview again on some of the things that you will use, different types of finger stick products that you may use. Again, this has a little cap. You'll take the cap off, and this is where the lancet comes out of. You will again clean the finger with alcohol. Now, I am not diabetic, but I have practiced these on myself to see what it feels like. And if you are diabetic, well, then you know that it doesn't, it's not an excruciating pain. It's kind of like getting stuck by a thorn. So if you're doing this on a daily basis, if you're doing this every single time, for example, ACNHS or Q 4 hours, Q 6 hours, Q 8 hours, the finger can become pretty sore, can be kind of painful. So make sure you alternate. You can use a thumb, digit, middle, pinky finger, alternate, take it easy on your patients. Also, where you're going to stick is you're going to want to stick on the side, on the meaty portion, about so. Okay, you can alternate again to this side here, here, here. Stick on the meaty portion. It's going to be less painful for your patient. This is another form. Same thing here. You're going to press here, and the lancet comes out of that area there. So you press down and poke. And as always, you're going to use gloves. As always, you're going to clean the area very, very thoroughly with alcohol. Now, when you wipe down, give it a little bit of time for that alcohol to evaporate. Otherwise, it's going to sting even more when you poke the skin. Okay, after, you're going to give them a little 4x4 and just have them hold it to stop the bleeding. Okay, make sure you always wear gloves. So that is really, really brief. Now, if you're going to give insulin, again, you must know how to use these. You must know the correct dosage. Make sure that you're pulling the correct amount. This here is larger than this. If you're going to pull 6 units, you pull about there. Okay, that'll be about 6 units of insulin. So make sure you grab the correct syringe, because I have had nursing students that get this syringe and they pull this amount. thinking that it is 6 units. This is not 6 units, this is 60 units. So a very, very big difference. You do not want to give this much insulin to your patient because you'll cause them to become extremely hypoglycemic. Okay, so again, that is what you would do. First of all, you would assess your glucose level, so you would do a finger stick. Now, again, this is just so you know how to do it. Most of the time, you would tell your CNA, you would delegate this task to your CNA or the LPN. Okay. Number 2, you would give IV fluids. Again, we talked about how they're going to have polyuria, voiding frequently, so you want to replenish those fluids. You want to stop them from becoming dehydrated. So you give them IV fluids. Number 3, you'd monitor their level of consciousness. We talked about if, for example, HS occurs, they're going to have some mental changes, confusion, somnolence. So again, you'd monitor that, you check that. Any changes could mean that maybe HS is occurring. It might mean that they are becoming dehydrated. It might mean that they need insulin or their PL medication. Again, finger sticks may be done before meals and at hour of sleep or before going to bed. Finger sticks may also be Q4 hours, Q6 hours, and this will depend on the physician preference. You place them on a diabetic diet. Again, you're going to hold PL meds, for example, metformin, if they're going to have some type of CT scan, anything with iodine contrast. Okay, you would hold that day, and again, you would tell them to hold for 48 hours post. I'm going to monitor for signs of hypoglycemia. Now, I talked about these in detail in the lecture on type 1 diabetes, so please check out that lecture if you do not remember. Now, one thing that I forgot to mention is if you are giving insulin, again, one thing that you also want to monitor is potassium levels, because insulin is going to decrease the amount of potassium, so it may cause hypokalemia. So before giving large amounts of insulin, you must monitor their potassium levels, because if not, you will cause cardiac changes. If you think that there will be some cardiac changes, you must also put this patient on telemetry, maybe an EKG, because again, insulin is going to have an effect on potassium levels. So if they are hypokalemic, you would want to monitor the amount of insulin that you are giving, because it would further cause hypokalemia. Number 8, you will monitor open wounds. Because again, we talked about how these patients have prolonged healing times. That makes it more likely for them to suffer infection. So again, you're going to assess, monitor for pus, discharge, inflammation, redness, foul odor, fever, and you will report those to the physician immediately.